My name is Dr. Chakaya. I am a physician by training with a special interest in chest medicine or lung diseases. Lung diseases are a very common cause of illness and death in this country. About 1 in every 5 patients who visit any health provider anywhere in this country will have respiratory symptoms as the causes, as the reason for that consultation. Although there are very many lung problems, broadly speaking, lung problems can be divided into 2, respiratory tract infections or respiratory infections and non-infectious lung diseases. Non-infectious lung diseases include, of course, depending on the site of the infection, include things like the common cold. It is a respiratory problem. It includes pharyngitis and tonsillitis, which are diseases involving the upper airway around the area of the voice box. They include diseases that affect the large airways, the windpipe, and the conducting airways. We call that tracheitis and bronchitis. But of those infections involving the lung, the one that is most severe and the one that can kill is infection involving the substance of the lung, what people commonly refer to as pneumonia. Most commonly, nearly all patients with lung diseases will cough, and those who have got significant problems in terms of more serious problems will have some alteration in their breathing, so they will have a sensation of shortness of breath. They could also wheeze, and they could feel tight in the chest, and they could have fevers, and they could have chest pain. Sometimes the cough may be productive and unproductive of blood-stained sputum. So those are some of the common symptoms that people present with. In tuberculosis, for example, there's been great advances in the diagnostic approach to TB. There are now new techniques that can pick up TB very fast, unlike in the good old days. They are highly sensitive, meaning they pick up almost everybody with TB, and also highly specific, meaning that they are able to exclude people who don't have TB. And the test that I think everybody might hear about in the next few weeks or months is already here in this country. It's called the Gene Expert. The Gene Expert is it's a molecular test. It detects basically the core substance of the TB germ, what we call the nucleic acid, the thing that really directs the entire processes that occur in this germ. And Gene Expert detects that you have TB DNA in the specimen you are testing. But not only does it tell you that, it also tells you whether in fact your TB is sensitive to commonly used drugs, or it is in fact resistant to commonly used drugs. So that's a major advance in the diagnosis of TB. Treatment-wise, not much has happened as far as treatment is concerned, say in the last 10 years for the treatment of most common lung infections. In fact, for TB, there has been no new treatment for TB for over 50 years. And there are no new antibiotics for the treatment of other lung infections, which therefore brings me to the point that I think is critical. Nobody should prescribe antibiotics unless they are truly indicated. Not everybody with what looks like an infection in the lung requires an antibiotic, because the majority of lung infections, in fact, are caused by viruses. So if you have a cold or a bit of sneezing and a little bit of sore throat, it does not necessarily mean you need an antibiotic. Overprescription of antibiotics, most commonly for respiratory tract problems, is a wrong thing to do. It will lead to the development of drug resistance. A lot of patients with HIV tend to have chest problems. Up to 70%, not in the past, even now, 70% of people who are HIV infected, that is not treated. This is the key thing, that untreated HIV About 70% of these patients will experience a major respiratory disease in the course of their illness. So very, very common. Tuberculosis, for example, in this country, we know that up to 40-50% of patients with TB are HIV infected. A large proportion of patients with HIV will develop tuberculosis. They also tend to have recurrent pneumonia, so they tend to get severer form of pneumonia. They can get rhinosinusitis, severe forms of sinusitis, and recurrent forms of sinusitis. So yes, certainly HIV is closely linked with respiratory disease, but it's important to know that not everybody who has pneumonia, for example, has HIV. I think the key message here is that if you do develop if you develop infectious disease of the lung, pneumonia, for example, you need to have a HIV test done to exclude the HIV as the background condition that led to that pneumonia, or that TB for that matter. The diagnosis of pneumonia is actually pretty simple. The classic case of pneumonia is somebody who comes to you with cough and chest pain and alteration in breathing over a very short period of time, usually less than a week, most often several days. And when the doctor examines this patient, they will usually have a fever, so temperatures are usually more than 37.5. They will have fast breathing, which means a breathing rate that is more than 25. And depending on the type of pneumonia that is there, if it's a consolidation, for example, the lung is solid in there, like we've already said, they will have signs of what we call consolidation, meaning for doctors, they will hear things we call bronchial breath sounds, for example. Now, most patients with pneumonia, if it's picked up early, should not die. Appropriate use of antibiotics and supportive treatment should cure most patients with pneumonia. However, some people have risk factors for death. The very young, for example, children under the age of 5 could easily die, and those over the age of 65 could also die. HIV-infected individuals, especially when their immunity is particularly low, for example, CD4 counts of less than 200, could also be at risk of dying. However, the majority of patients with pneumonia properly treated will not die and will do very well with appropriate treatment. Again, early diagnosis here is the key. Most diseases of the chest are treatable. Some, of course, are not curable and are controllable. It's important, for example, for people to know that asthma is not a curable disease, but when it is treated appropriately, people with asthma should live very normal lives. Patients with COPD can be treated successfully. However, this is one disease that nobody wants to get or nobody should get, and therefore it's critical for people not to take up smoking. Lung cancer, a rare tumor in this country, fortunately, a very, very uncommon tumor in this country, and we hope it will remain that way. If you catch lung cancer early, when it is in stage 1 or stage 2, potentially, yes, that tumor can be cured. And if you catch it later, stage 3 or stage 4, then really nothing much. Well, I mean, things can be done, but the cause of events may not be altered favorably in terms of death. So again, early diagnosis is critical under those situations. I think we haven't done as much as we should have done. There's been a lot of emphasis in this country on tuberculosis, and I think certainly tuberculosis was a major problem for us, so it made a lot of sense to spend a lot of time discussing and creating awareness about TB. But I don't think we've done the same with, say, tobacco-related lung disease or asthma and other many diseases, including diseases that have a cause primarily at the occupational setting. We haven't discussed this, but there's a huge group of diseases of the lung where the cause is something you encounter at the occupational setting. Exposure to dust and vapors and all sorts of things at the occupational setting are a very common cause of lung diseases world over, and presumably also in this country. And I don't think we've really created the awareness that needs to be created for people to be able to take action that is appropriate when these diseases occur or to prevent these diseases. The Kenya Association for Prevention of TB and Lung Disease, KAP-TLD, is trying, but it is rather poorly resourced, and therefore I think the magnitude of that effort is minimal. And again, like I said, that effort has been heavily weighted towards TB rather than other lung diseases.